So we continue our topic. We are discussing the drugs which are used for cough. We are discussing expectorants. In the expectorants, there are two group of drugs. We have the drugs which increase the bronchial secretion, and there are drugs which break down the mucus. The drugs which break down the mucus, they are called as mucolytics. In this group, we have the bromhexine, ambroxol, acetylcysteine, and carbocysteine. Today, we will be talking about bromhexine group of mucolytics. So this bromhexine is a mucolytic. This break down the mucus in our respiratory passages. What it does in the sputum, we have a lot of mucopolysaccharides. Mucopolysaccharides is present in the sputum, and that mucopolysaccharide is in the polymerized form. And this mucopolysaccharide keep the sputum thick, viscous, and that thick viscous sputum is very sticky to our respiratory passages. So when we give bromhexine to the patient, it directly depolymerizes this mucopolysaccharide. It depolymerizes. It depolymerizes this mucopolysaccharide and thus makes this thick sputum into thin, and this less viscous sputum is easily passed out of the respiratory tract. So when we give this syrup bromhexine, it will convert this mucopolysaccharide in the which was polymerized form into depolymerized form. Also, it also causes release of certain lysosomal enzyme on the mucopolysaccharide and break down this mucopolysaccharide into thin strands, and that is easily make the sputum very thin, and it is passed out of the respiratory tract. So here we can see in adults we use 8 mg of tablet of bromhexine, or we can also use the syrup. This is a 100 ml bromhexine syrup, bromhexine hydrochloride. Here it is written, it helps in clearing our chest congestion. So each 5 ml of the syrup contain 4 mg of bromhexine. For a child in the age group of 1 to 5 years, we give 4 mg BD. That means 5 ml BD dose. For 5 to 10 years of age, we give 4 mg TDS 3 times a day. Since it breaks down the mucus and converts the mucus into thin mucus, thick mucus is converted to thin form with the use of this bromhexine. It also thinned out secretion in various other parts of the body and thus producing various side effects. Like it in the eyes, it thins the secretions and that can cause lot of lacrimation. In the nose, it can cause rhinorrhea. In the gastrointestinal tract, since there is a mucus layer which prevents this acidic damage to the stomach because of the presence of mucus layer. But when we give this bromhexine syrup, it breaks down this mucus layer and thus predispose the patient to ulceration, that is, it can cause peptic ulcer disease, since it breaks down the mucus which is protective for the stomach. Since mucus is broken down, and they are more predisposed to ulceration. It can also cause hypersensitivity reactions. So this was about bromhexine. One more mucolytic drug is the ambroxol. This is also a mucolytic. It also converts the thick viscous sputum into thin sputum, and it is easily removed from our respiratory passages when the sputum becomes thinned. And its action is almost similar to bromhexine, that it breaks down the mucopolysaccharide present in the sputum. So its action is almost similar to bromhexine, and also the side effects are similar to bromhexine, that it can cause lacrimation and rhinorrhea and ulcerations in the abdomen. So this ambroxol comes in form of tablet and in the form of syrup. The tablet comes as for the adult, the dose is 30 mg, which is given thrice daily dose of ambroxol. In the syrup, its 5 ml contain 30 mg of ambroxol. For us children, if the children age is more than 10 years, it is given 5 ml thrice daily. Between 5 to 10 years, 5 ml twice a day it is given, and between 2 to 5 years, it is given 2.5 ml thrice a day. For less than 2 years, it is given 2.5 ml twice a day. So this is the ambroxol syrup which is used in children. It is 100 ml and 5 ml contains 30 mg of ambroxol. Another drug is acetylcysteine. It is also a mucolytic. So what does it act? How does it act? It basically converts this thick mucus into thin mucus. It goes into the sputum, and in the sputum there are present mucoproteins. These are the mucoproteins which are present, and each mucoprotein is bounded with each other with the help of these bonds. These bonds are called as the disulfide bonds. And because of the presence of disulfide bonds, these mucoproteins remain attached to each other in the sputum. They are attached with each other with the help of disulfide bond, and this makes the sputum very thick, and because of which it is very difficult to remove the sputum from the respiratory passages. So when we give this acetylcysteine to the patient, what does it do? It goes into the sputum and breaks down these disulfide bonds present in the sputum, and because of which these mucoproteins are broken down, and the sputum, which is very thick, it becomes very thin because of the breakdown of mucoproteins, because of the breakdown of disulfide bonds present in the mucoproteins. So this acetylcysteine is used in those conditions where the mucus is very thick and it is very difficult to remove the mucus from the body. For example, in those patients who are tracheostomized, and in the tracheostomy tube there are a lot of secretions which are collected. So this thick sputum is what we do. We will give these injection, or it is directly injected into the tracheostomy tube, these ampoules containing the acetylcysteine. So this 2 ml contains 400 mg of acetylcysteine. It is directly nebulized, or it is directly inserted into the tracheostomy tube, and this tracheostomy tube containing the thick sputum, it becomes very thin, and it is easily removed from the tracheostomy tube by suctioning. It can also be nebulized in those patients who are having sticky chest and chest congestion, where there is a lot of sputum has been collected because the sputum becomes thick and it is difficult to remove. For that we also give these acetylcysteine nebulization, or we can directly insert these ampules in tracheostomy tube for removing the thick sputum. And this acetylcysteine, since it is also breaking the mucus, it can cause peptic ulcer disease. Another drug is carbocysteine. It is also a mucolytic and its action is also similar to acetylcysteine. So this carbocysteine comes in the form of capsule, which is 375 mg of capsule of carbocysteine, or it can come in the form of syrup, where 5 ml of carbocysteine contains 250 mg. 5 ml of the syrup contains 250 mg of carbocysteine. So we can combine this carbocysteine with antibiotics like amoxicillin or cephalexin. When this carbocysteine combines with amoxicillin, it is called carbomax, and when it is combined with cephalexin, it is called as carbicef. Here the dose of carbocysteine is 150 mg, while the dose of antibiotic is 250 and 500 mg. So this antibiotic is required in conditions where there is component of infection present. For example, in patients with chronic bronchitis where the mucus is thick and there is likely risk of infection in the mucus. So we give them in chronic bronchitis. We also give them in bronchiectasis where is also infection component is there, and in sinusitis. So its action is almost similar to acetylcysteine, and also it can cause it is contraindicated in peptic ulcer disease as it breaks down these mucus layers, because it is mucolytic and it breaks down the mucus layer, and this stomach will predisposed to acid damage, and that's why it is contraindicated in patient with peptic ulcer disease. So these was the group of drugs. These are the mucolytics we used in cough.